Hey guys, come along with me to do some TMJ talks. As you can see, we're treating trigger points in the trapezius muscle. So I first assess that by applying some pressure to that area. I usually apply around 6 to 10 seconds of pressure. I ask my patient if the pain is mild, moderate, severe, and then if it is radiating. If it is radiating, it is a true trigger point. If it is just localized to one area, it is a sign that it is just myalgia. This patient has been a patient of mine for a while now. She gets consistent TMJ treatment. It really does help her. So what we do is we mix that Botox and that lidocaine together. Using this 25 by 1 inch needle, we're working it into the tissue. So as you can see, I have that tissue tented up really well, and I'm making sure that tissue is not slipping. And I'm also making sure that I'm not utilizing more than 3/4 of my needle depth. It's very important here to maintain patient safety. So by pinching up on that tissue and watching that needle depth, you are maintaining that your patient is safe. If you are too deep or you angle down, you have a potential risk of getting a pneumothorax. So please be mindful of that. Take it seriously. But as you can see, I'm just working that needle in and out of the tissue. If I'm feeling any resistance or texture in that tissue, I'm pushing a little bit more product and I'm working that needle a little bit more. And then when I feel like that tissue is feeling better and feeling smooth, I'm going to come out with my needle. So really just working that tissue. I tell people try to stay in there at least 30 to 60 seconds to get good therapeutic relief and breaking up that muscle. Going on to the other side, I'm going to repeat the same process. So as you can see, I'm tenting up that tissue again. I'm going always parallel with the floor. I like to keep my needle parallel floor because that makes me feel like I am being safer. I'm trying never to angle that needle down because I'm being mindful of that diaphragm in the lungs. So I know it seems kind of far-fetched that you'd ever hit it, but it has happened in the past. So just be mindful. And patient population really determines that. So if you have more of a petite patient, you're really going to want to be mindful of that. But overall, making sure you're tenting up that tissue. I stay parallel with the floor, so I know that I know where my needle is at all times. And then I'm working that tissue. I tell people you could always work in 180 degrees. So you have kind of like a sunrise pattern to follow to really break up that tissue and really work that muscle. So that is the goal. As you can see, I'm still watching that needle depth overall, pushing product as I meet resistance. And then once I feel like that tissue has improved and that adhesion broke up, I am coming out with my needle. But overall, this is a really good therapeutic treatment to include on your patients. So make sure you're doing those TMJ assessments and treating them if it's necessary.